Bridging the Gap, Reducing Maternal Mortality Among Black Women Through Quality Improvement Strategies. Despite advancements in maternal health care, Black women in the U.S. are 3 to 4 times more likely to die from pregnancy-related complications than white women. These outcomes persist regardless of income, education, or social economic status, indicating that systemic factors, including racism and bias within the healthcare system, play a central role. According to the CDC, the maternal mortality rate for Black women in the U.S. in 2021 was 69.9 deaths per 100,000 live births, the highest among all racial and ethnic groups. The CDC further estimates that 84% of maternal deaths in the U.S. are preventable. These alarming statistics highlight the urgency of addressing maternal health disparities through structural changes and targeted interventions. The purpose of this project is to address the critical issue of maternity mortality among Black women in the U.S. and to propose a quality improvement plan that promotes equity in maternal health care. Despite advancements in medicine, Black women remain at a disproportionately high risk of dying from pregnancy-related complications. We will explore evidence-based strategies to reduce maternal mortality and propose an intervention rooted in standardized care and cultural competency. Okay, we have 3 goals. To implement culturally competent care training in maternity units within the next 3 months. 2 would be increase provider adherence to standardized maternal care protocols by 25% within the next 6 months. And then 3, to reduce preventable maternal complications among Black patients by 15% within 1 year. Okay, one of the articles I read is called Eliminating Racial Disparities in Maternal and Infant Mortality, a Comprehensive Policy Blueprint. So this article, it highlighted that implementing nurse-led patient education and discharge follow-up programs improve outcomes among high-risk Black mothers. Also in this article, researchers presented a comprehensive policy blueprint that aimed at eliminating racial disparities in maternal and infant mortality. The report identified systemic racism, implicit bias, and limited access to quality postpartum care as primarily drivers of poor outcomes among Black women. They proposed strategies which included expanding Medicaid coverage, funding a doula and home visitation programs, and requiring implicit bias training for all maternity care providers. Notably, the study emphasized the importance of nurse-led patient education and postpartum follow-up care in reducing complications and death. This evidence supports the implementation of culturally competent, community-based interventions as part of a broader quality improvement strategy. The second article I read is labeled Reduction of Peripartum Racial and Ethnic Disparities, a Conceptual Framework in Maternity Safety Consensus Bundle. Researchers Howell and colleagues, they emphasize that institutional racism and implicit bias in medical decision-making significantly impact care quality for Black women. So they developed a conceptual framework and maternal safety consensus bundle to reduce racial and ethnic disparities in peripartum outcomes. The framework emphasized the role of institutional racism and provider bias in influencing maternal outcomes. The key strategies used included standardizing patient care processes, integrating early warning systems for emergencies, and improving communication among healthcare teams. The study also showed the need for cultural sensitivity and accountability in obstetric care to improve safety and outcomes for Black mothers. So, this quality improvement plan is to reduce preventable maternal complications and deaths among Black women. We would do this by standardizing care protocols and training staff on equity biases. Use evidence based checklists for prenatal, labor and delivery, and postpartum. This will help prevent missed warning signs such as hypertension and hemorrhaging. Require all OB staff to take bias and culture competency training that includes simulation, role play, and case based learning. This will improve provider awareness, communication, and trust. Secondly, schedule follow up visits before discharge. This goes along with partnering with a doula, community health workers, and telehealth programs. Focus on education, monitoring, and support in the fourth trimester. Third, third, technology integration. Use technology to enhance care. So use the electronic health record alerts to flag high-risk patients, track missed postpartum visits, prompt follow-up care coordination. The goal here will be to improve team communication and early intervention. We would evaluate this plan by monitoring maternal morbidity and mortality rates pre and post intervention, staff compliance rates with new protocols, pre and post surveys on provider culture competence, and patient satisfaction and engagement metrics. The model most appropriate to use in this situation would be the PDSA model. So, plan, develop standardized care protocols and training content. Do would be pilot the plan in one maternity unit. Study would be analyze metrics such as maternal morbidity rate, staff training completion, and patient satisfaction scores. Act would be to adjust the plan based on findings and expand implementation across additional units. Maternal mortality among Black women remains a pressing and preventable public health crisis. By implementing standardized care protocols, staff education, and technology assisted follow up systems, healthcare institutions can reduce these disparities and improve maternal outcomes. Nurses play a critical role in leading and sustaining these changes, advocating for equitable care and ensuring that every woman receives safe, respectful, and effective maternity care.